Yes, I'm here.
So who's there? Sheen. I think Sheen would. I think people are still getting in, so she'll indicate whether we should start. I see. Yeah. Whether we should start. I see it's already 10:02.
You can go ahead and start, sir.
So good morning. Good morning, everyone. I think there'll be more people joining us, and yeah, we will let those people join in. I'm just mindful of time and of wasting any minute any longer. So thanks a lot for making the time. Thanks a lot for being here after a tough week. It's a bit chilly out there in Johannesburg. So I'd like to thank the panelists for being here. And I'm looking forward to a very interesting discussion ahead. I'd also like, my name is, by the way, Regime Walusi. I'm the Executive Director at the South African National Editors Forum. I've just rejoined the organization, having previously been Secretary for Gauteng, having previously been General Secretary and Convener for Gauteng, So I've just rejoined the organization. But thanks a lot to Internews, to Frey Intermedia, and thanks a lot to all that worked on this guide. It's quite a key and important guide for us as SANEF, for Internews, and for the industry itself. I think our industry, sadly, in the past 15 months or so, we have lost a whole lot of colleagues. Some of those colleagues were close to us, they were friends. They were more than friends. They almost became family. So yeah, our heart still goes up to those, and we're still losing more colleagues. But the guide itself that we are launching here, we are launching this guide, amidst SANEF, actually, engaging government to really get journalists vaccinated, more especially journalists under the age of 35. We are working quite hard on that. We are in continuous engagement with government regarding that, and we're looking forward to that. So yeah, the guide itself is quite key for our industry. It's quite key for journalists that go out there. And I'm glad that the panel we have today, we've got someone who worked on the guide itself, on editing it, on working on aspects of it. We've got very experienced journalists to really take us through the discussions, journalists that are running newsrooms, journalists that are going out there on the field. So without any further ado, I'd like to welcome Mia Malan. Mia would moderate this discussion for us in the next hour or so. And Mia, as we all know, is our editor-in-chief of Bekisisa. Mia has about 25 years experience in our fraternity, journalism fraternity. She's award-winning. She's won several of these awards when she was with the Mail and Guardian. You may have seen the byline there over the years. So thanks a lot for making the time. And then, yeah, thanks for being here. I'll hand over to you, Mia. You on mute, Mia. Mia.
Sorry about that. Thanks very much, Reggie. And first of all, congratulations to SANEF and to Internews and Frame Media with this guide. It's a great resource for journalists, and particularly during a time when so many journalists have been forced to become health reporters overnight. because of a pandemic. So it's really great that there's now a resource like that. We have 30 minutes for this discussion. So to save time, I'm going to introduce each panelist very briefly just before they speak. And I'm going to ask each of them a question to which they will respond in about 5 minutes. And then we'll have about 7 to 10 minutes for questions from participants or the audience, and also comments. So please do order your questions or comments in the Q&A box. So I'm going to start off with Portia Kubi, who is the former CEO of Health E, and she was a reviewer of this COVID reporting guide. And she's also a journalist who has reported on health. So Portia, because you were one of the reviewers of this guide, and because some of us haven't seen it, not everyone who joins has seen this guide, can you please take us through what it covers and why do you think journalists would find it useful?
So thank you very much, Mia Malan, and congratulations to SANEF, to Frey College and interviewers for coming up with this guide. I'm very, very passionate about these tools that journalists can use. You know, in the interest of saving time, I'll just refer to 2 chapters. They just happen to be the first and second chapter of this guide. And the first chapter, obviously, is really around ethics, journalism ethics, but specifically focused on reporting a pandemic. And, you know, the heading is very, very appropriate. It says pandemic-specific obligations on the media. And I think that's really one of the important things. And I would just pick one of the facts there, which is, you know, protecting the privacy, dignity, and rights of the public as we report on them. I'm choosing this specific one because I think it's very, very important for us as journalists, as you have said, Mia, that, you know, overnight we have become health journalists of a pandemic that we don't really know much about, that we're still learning much about it. It's very, very important for us to protect the privacy and dignity of ordinary citizens. And I'm saying this because sometimes as journalists, we become passionate about what we are reporting on in the hope of assisting and helping or helping to highlight challenges that ordinary citizens have around an illness, around a pandemic. And while we do this, we need to be very, very careful not to violate people's privacy and their dignity. We should really ask ourselves, if it were me, would I like people to know this about me or to know about it in this particular manner? Or would I want to go out in public and say, this is me and I'm suffering from this condition? I think that's very, very important. And I believe that there's always a way, even with our pressures as journalists, to find ways of making sure that we stop for a minute and reflect on what we are writing about, if it's possible that we could be violating someone's dignity and privacy. And I would also talk about challenging hate and respect people's rights to choose. Just because people don't want to be vaccinated does not make them the bad ones. Or just because people are not wearing masks, it does not make them the bad ones who don't want to cooperate. I think we should do what journalists, you know, really are good at, which is trying to find out without judging other people, trying to find out, why are you not wearing a mask? You know, why do you not want to be vaccinated? And also avoid labeling people, you know, as spreaders of the pandemic, or however we want to label them. And I'll just quickly also just go to chapter 2, which talks about personal safety for journalists. I think that's very, very important, that while journalists are running around with all the pressures of reporting about an unfolding story, journalists should really be careful to look after themselves. And, you know, chapter 2 really speaks to that. I think that is super, super important. And also chapter 3 talks about mental health. You know, journalists must also look after their own mental health while they do this. I know that it's a lot, but I think that if we do even a quarter of what the guide is advising us to do, we will go a long way in really reporting the pandemic in a way that it really has meaning for people and is helpful. Thank you.
Thanks, Portia. Are those all the chapters that you've gone over, or have you just covered the first 3? Do you want to briefly just say what's the rest of the manual?
Okay, so let me just see if I can get to the manual now. But I mean, the manual really addresses all the issues that have to do with reporting, but how do we report in a way during the pandemic that really gets the best for the public that we are reporting on? So unfortunately, Mia, I can't seem to be able to open the manual here. I can try quickly to just...
That's okay, Portia, don't worry about that.
Okay.
I have the manual open here in front of me. So just
All right,
to,
yeah, so you can just go with it. Thank you, Mia.
okay, so there's the chapter on the role of the media in a pandemic. There's a second chapter that Portia has spoken about safety for journalists during a pandemic. Then Portia also mentioned the chapter on mental health. And then chapter 4 looks at working agreements. And then there's a chapter on the basics of health and science reporting, and a chapter on vaccinations and how they work. And then last 3 chapters on telling a greater range of stories. So ideas of what kind of stories we can tell during a pandemic, a chapter on misinformation and how to deal with that, and then a last chapter on stigma, and looking at, Portia did speak a little bit about that, on how do we not create discrimination and stigma during a pandemic. We're now going to move on to Ina Skosana, who is the medical and the health editor at The Conversation Africa. And Ina also helped to write a chapter in this guide. And enough to you, I would like to ask, I have seen a lot of these guides being published over the last 6 months, around Africa, also internationally. And so often these manuals become documents that tick a donor box for funding, and they live on a website where no one uses them. So you've been involved in the creation of this manual, and you've also reported on health quite a bit yourself. So why do you think this content will be useful to journalists?
Hi, Mia. Thanks for the question. I think that, yeah, you're right. There have been quite a lot of these guides coming out, but I haven't seen one that speaks specifically to reporting in a South African context. And I think it is so important, to look at, especially, there are different laws and different contexts within which the news happens. So as much as the science and so on are the same, but we see that there are country-specific situations. And I found that wasn't really available. So I hope that basically that this guide will be one step closer to a journalist that's reporting in South Africa. And I hope that this document is more accessible and easy to read and useful. It's not necessarily meant to be sat down and read like a handbook, but it's supposed to be a shorthand, what it is that you want to know right now, especially for reporters who haven't really worked in the health field before. And yeah, I just really drew on my experience and the things that we would want to know, that I would want to know heading out onto an interview. We know that time is short. I also think that this manual looks wider at journalists, not just as a reporter, but it talks about the self-care and the personal care. And I think also a key aspect is the workplace agreement. Sometimes we forget, we don't necessarily look at ourselves as workers and rights in those aspects. So I think that's also a key aspect of this guide.
Thanks very much. Ina, you mentioned you included in the chapter that you write things that you wanted to know as a journalist. So do you want to tell us which chapter you wrote and which are the things that you want to know as a journalist?
So I contributed to the chapters on the basics of health and science reporting, and also on vaccinations. And I think that they're just basic things that we use a lot. I always use terminology as an example, that when we're speaking to scientists, these people are really, really busy. They're at the forefront. And a lot of the times they use words that we just repeat without actually explaining what it means. We've seen that a lot when it comes to vaccine efficacy and effectiveness. And now when people who have been vaccinated against COVID still get infected, now there's a confusion because, I'm vaccinated, isn't it supposed to protect me? And I think just by learning some of the basic terminology, or at least knowing where to find it, can help whoever is speaking to an expert to can kind of contextualize better what was said, other than, that goes beyond simply quoting.
Thank you very much, Ina. And you've got a great point there, that there's so much terminology that we've had to deal with in this pandemic, and not actually, even beyond efficacy. Things like positivity rates of tests and types of vaccines. No one of us really knew there were different types of vaccines before the pandemic. So it's really great that you explain those things in the manual. We're now going to speak to Heidi Jokos, who is a business journalist from ENCA, and she now reports on COVID. And Heidi is really, at the lack of a better word, one of the media products of the COVID pandemic. Before COVID, Heidi, you were a business journalist, and overnight you were forced to start to report on COVID and become a health reporter. And although you're still a business journalist as well, you now have to spend a considerable amount of time on reporting on a beat you were previously unfamiliar with. And on top of that, you have contracted the virus that causes COVID during the course of your duties. You've been sent out to vaccination clinics and COVID sites for many months, for most of part of this year. Now, if you look back over the past year and a half, and you could make a list of what would have helped you as a journalist to report on this pandemic, what would that be? And is that in the manual?
Sure. Thanks so much for the opportunity. I think it's extremely important that we have this discussion, because you find many journalists out on the ground and in the field having no idea how to report on health or the pandemic. So this guide, I think, truly summarizes what I was going through. Firstly, I was a very paranoid person when the pandemic hit. I'll never forget the day when the first case was reported in South Africa, and I was running around the newsroom saying, I don't believe this is actually happening. And everyone told me just to calm down. It's not going to be as dramatic as we're seeing in the other countries. And look where we are a year and a half later. But I was overly cautious. I was extremely paranoid. And what made things a lot difficult for me was the fact that I contracted the virus at a time where we didn't know much about COVID, where it was almost frowned upon if you contracted COVID-19. We weren't sure what was going on, how severe it would be, how quickly I could, transfer the virus to my loved ones. And that just created a whole lot more paranoia for me. But overnight, I became a reporter for health. I've been in vaccination sites for almost every single day this year. Today's the first day that I'm doing a story not based on vaccines, which is so exciting for me. But the two chapters that really stood out for me in the guide was the mental health. And I don't think we really acknowledge and understand what COVID-19 has done to many, many people, especially people that are out reporting every single day in clinics, every single day at vaccination sites. It's a huge strain. In the last 2 to 3 weeks, I found myself actually getting extremely emotional, because I just feel that if there's a vaccine available, why aren't we vaccinating? We could avoid so many deaths. So the mental health aspect and the chapter really, it hit home for me, because sometimes you neglect your mental health because you're so busy reporting on COVID-19, getting that information out, and you forget about your own well-being. So that was extremely critical for me. Something else that also stood out for me was the stigma chapter, because I also, when I reported that I had COVID-19, people were saying, wishing that I pass away. People were saying the most horrible things to me. And it's almost like there was a stigma created around me because, look, I'm a journalist and I'm reporting on COVID and how this and this and that, but I still contracted the virus. So it was it was heartbreaking to see, and I see a lot of communities also go through that, where they don't have access to healthcare, they don't have access to vaccines, they don't have access to transport to get to these vaccination sites, they don't even know how to switch on their cell phones or use a smartphone. And there's a stigma created around the accessibility of health facilities and healthcare in this pandemic. So if I look back to a year ago or a year and a half ago, when I was told I'm going to be reporting a lot more on COVID-19, the main thing that stands out for me is information is key, and that's what you need to stick to. Stick to the facts. You don't understand something, you pick up the phone and you ask. Mia is fully aware of that. I'm always on the phone with her when I don't understand something. And it becomes very overwhelming. I was a business reporter, you know, I was always about the numbers or the state-owned entities, and I had to move over to these health terms that I had no idea what they meant. So information is key. The facts are there. Stick to the facts. And, you know, there's always help out there, and people are always willing to engage and provide more clarity. So if I look back, it's just making sure you look after yourself. Just avoid the noise, because people will always say something, oh, look, people are vaccinated, but they're still getting COVID. And it's, you know, but stick to the facts of what the vaccines actually do, and always ask for help when you don't understand something. So that's my overview and analysis of looking back, what really helped me moving over from being a business journalist to now focusing on the COVID-19 pandemic.
Thank you so much for that overview and for making it so practical, Heidi. One last question. If you had to have a terminology list at the beginning of the pandemic as someone who didn't report on health, what are the 3 concepts that you know, or terms that you struggled with that you would have loved to see explained in a really great way, right straight away?
I think the issue around positivity rate, you know, many people are saying, oh, look, our numbers are down. We had less than 10,000 reported cases yesterday. But if you look at the positivity rate, and if you look at the number of tests that we did yesterday, you know, you need to look at the broader picture. So definitely positivity rates, and also the issue around vaccines expiring. I mean, when that came out, we were all like, what? How can vaccines expire? What is going into my body? So definitely, I think that was key, and also the efficacy of vaccines. You know, people were saying, but COVID-19, if you get the vaccine, you won't get the virus. But how effective is it against actually getting the virus and not being hospitalized? So I think those 3 things are extremely important. Well, for me, that stood out. I was like, I don't understand this. What does this actually mean?
Thank you, Heidi. And that's so great that you also mentioned the expiry dates. I remember how much confusion there was when the AstraZeneca vaccines came, and it was mentioned that the expiry date of a vaccine can be postponed, basically. And it sounded almost like fraud. And that whole explanation that had to be given, that these vaccines are very new, and because they're so new, we only know that they can last for 6 months. And as the time goes on, we can see if they stay stable. And I remember that was very confusing to me initially. And I was very grateful when someone explained that to me. So our last panelist is Mbali Dlomo, and she is the chairperson of the board of directors of the Association of Independent Publishers. And she's also the founder and the publisher of Tuku newspapers that serve many rural areas in KwaZulu-Natal. And Mbali, to you, I would like to ask, do you think the needs that community journalists on a very grassroots level have, do you think that's different from the mainstream media? And how can we address that through a manual like the one that is being launched today?
All right, thank you, Mia. Good morning to my fellow panelists and the audience that is here today. Thank you for this wonderful opportunity that you've given us and our sector to share our thoughts as we grapple with this devastating pandemic. The needs of community media journalists are very much different from those in the mainstream media, definitely. And I think this stems from the fact that our publications serve as a springboard from where most aspiring journalists and writers jump from. It is a known fact that the community media sector, whether it is print or electronic, has produced most of the journalists that we see in the newsrooms today on television and in mainstream publications. community media journalists' primary aim when they join most of us is to gain experience in the sector. What we teach them in our newsrooms, they want to implement in the field, regardless of pay and regardless of the various levels of comfort that most mainstream media entities afford to their journalists. They need that byline because that byline is what they will show to their families and to their friends. They know that that byline will gain them access to that major newspaper they wish to work for one day. So yes, community media plays a huge role in assisting young people who are keen to enter the media sector, mostly in rural and semi-urban areas where most of us operate. Our sector prides itself in being the entry point for most aspiring journalists in this country. Over the years, most of us who are publishers can bear witness to the fact that our journalists gladly embrace new information that comes their way because they know it will empower them with knowledge and potentially get them to the next level in their careers. Directly, this reporting a pandemic guide will assist our journalists with information which they might not have gained from our newsrooms because we have small entities and most of us operate from homes. So it's not conducive to have a lot of information shared at once. This virus is new to all of us, and one would never have guessed that in 2021, we would be talking about ways of reporting on it in the most appropriate and effective manner. This guide will go further than just being a document for now. I'm certain that the information carried in it will serve as a guideline for reporting on future pandemics and diseases that we are likely to encounter in years to come. And indirectly again, I will state this, most of our aspirant journalists come to us for experience. So if they have compiled articles about the pandemic in our newsroom, I believe this will most certainly stand them in good stead as they seek employment elsewhere. I'm pleased to see that one of the contributors who gave input when this guide was compiled is the late chairperson of the Association of Independent Publishers, Uwandile Fana. That was one person who was passionate about the advancement of our sector. And he was also vocal about the use of indigenous languages to get messages across to communities. I'm saying this in the hope that in future, this guide will hopefully be translated in all or most of the 11 official languages of this country and also in Braille. One day I would wish to have this guide in isiZulu so that our journalists in KwaZulu-Natal could really get the gist of the message that is contained in the pages. I would wish the late Wara's journalists at Skawara News to one day be able to read this guide in isiXhosa. And this goes for all the other official languages as well. So to us, this is most certainly a valuable document because it talks to us as media about a pandemic that is touching all of us because we have all been affected by it. And having a guidebook of this sort will assist us in not only understanding what is expected from us, but also to assist our young writers and journalists to be a step ahead with empowering knowledge and information in their pockets. Thank you.
Thanks very much, Mbali. And I would like to read some comments of participants. And one is saying it's so lovely to hear the voices of so many incredible women. This panel is awesome. So thank you to all the panelists for the great points that you've made. And there is also a comment from Ida Uesto, who is the Senior Health Journalism Advisor at Internews Network. And Ida is a South African journalist. Many of you may remember her from the SABC a few years ago, being a health journalist on Focus, the current affairs program, reporting on another pandemic, HIV. And Ida has now been involved very widely in training of journalists on COVID, and not just in South Africa, but across Africa. So I would like to read Ida's comment and then ask her to respond on what makes manuals such as these sustainable. What prevents them from being the flavor of the month for a month, and then there they go. I'm just going to Ida's comment. She says, good point by Mbali. COVID-19 is a national, regional, and hyper-local story, all at once, hence the need for a guide such as this one and other global resources. So Ida, can you tell us what would make a manual sustainable? What is it that would make a manual be used beyond just a short while? You can maybe put on your camera and tell us. Are you there? Yes, yes, there's just, do you want to put on your camera or just talk?
I will just talk because my internet is not great. Can you hear me?
Yeah, we can hear you well.
Wonderful. Thanks, Mia. Congratulations, everybody. I'm also very excited about this guide and just really appreciated those points you made just now, Mbali, about language and how important community media is. I just wanted to put that comment out there because I think in addition to what Heidi and others have said, you know, the challenges to us as journalists is that it is of course, it's a pandemic, it's a global story. So we absolutely need to be connected to those global conversations. Wherever we live, we're in a region. I mean, we see in which ways the sub-Saharan African region is particularly affected with a 43% spike in cases reported this week. It's a national story. Our country has just been through, violence of another nature, and that in itself will, we can almost with certainty predict, have COVID spike. And then, of course, as you've said, Mbali, it's a story in particular communities. So, Mia, your question is, how do we keep such guides alive? Language is important, but I also think the ability to be able to engage and interact with the writers of a guide and with one another as journalists. I mean, as on this panel, but I think through the various WhatsApp groups that have been established over time, through the networking amongst journalists, journalists like Ina has been such an amazing health and science reporter and editor for such a long time. And then Heidi, as you've described, you have come to this, you know, from a different field. I've seen lots of interaction between seasoned health journalists and non-seasoned health journalists, you know, those like you, Heidi, who, you know, who's done a wonderful job. So basically all those networking opportunities are peer learning opportunities. And I really would want to encourage everybody involved with this specific guide to also make it an iterative and interactive moment. In other words, when things become updated, when there should, you know, should there, for instance, be another new variant, you know, create a sort of sub-discussion around that and how to report on that. Be connected amongst one another. That's one of the things that Internews really encourages. So if you'll allow me, I will post, I've just sort of assembled a whole lot of guides that we have in addition to these. Many of these are global guides. As I've said, it's also a global story. There's also a glossary. There's also the fact that, you know, of course, we all know that COVID-19 has reminded us of One Health as a story subject. In other words, there's also a zoonosis toolkit to help us understand species jump of pathogens like COVID-19. In any case, I hope I've answered your question in a nutshell. Stay connected, find ways to even make guides like this, to create a WhatsApp version or a podcast version of guides like this, so that journalists who really enjoy interacting with one another on WhatsApp can kind of continue to keep the conversation alive. I think journalists have learned a lot from one another, not just from experts and scientists and advocates. So continue with the good work. And I'm so proud also being a South African to see what's happening. Thank you.
Thanks very much, Ida. And it would be great, Reggie, to hear from SANEF a bit later how you plan to promote this guide and make it alive in WhatsApp groups and other networks, such as what Ida has mentioned. There's an interesting question from Nigel Mugamu. He's asking, has anyone on the panel been vaccinated yet? And if you haven't been vaccinated, does it make you anxious? I got my first jab yesterday at 4 Ways Mall at Diskim. And I was very excited, and I haven't had really side effects, only a little bit of a sore arm. So Ina, have you been vaccinated, and anyone else in Bali, Heidi?
Hi, Mia. No, unfortunately not. I don't qualify yet, but I must say on Sunday we went to Paraguana, and I was standing in the long line with my partner, and as he went in and I had to turn back, my heart was really sore, but I'm really excited to to also get a jab soon, hopefully.
Heidi?
No, not yet. Unfortunately, we don't qualify as young ones. But the minute it's open, I think I'll be first in line.
Mbali?
I got my date last week, and I'm yet to get it to do the jab Wednesday. But one thing I'm happy about is that both my parents have got the 2 jabs already each, and they are fine. No side effects, nothing, and I'm pleased with that. So it's up to me now and the rest of the family who are of age to do the jab as well.
And Portia, thanks, Mbali.
Yes, so I had a bout of bronchitis just as I was about to go and get vaccinated, and my doctor advised me to just get on treatment and finish it. And so I'm also getting ready to go and vaccinate it, but I did not get a confirmation from, from registering online of the date and where I should go and vaccinate. So I'm just going to go and crash somewhere and just get my vaccine.
That's a great idea. It's exactly what I did. So you can really just book a diskim or at another place online. You don't have to necessarily wait for that message. We have time for one more question, and I would like to ask that of Tiran Onifadi. And the question is, where are the men? Does gender play a role in COVID coverage in South Africa or elsewhere? And that's a great question, because traditionally health reporting has been dominated by women, particularly in Africa, because there are so many reproductive health issues that we report on. Heidi and Ina, I'm going to ask you two to respond to this, because Heidi, I want you to tell me, at ENCA, do men ever get the chance to report on COVID-19? And then I would like Ina to respond on, do we have enough men, and what do we do to get the men to also report on pandemics? Let's start with you, Heidi.
I don't think I give the men a chance in the newsroom. No, but we do. I mean, we have Mangoba, who has been quite active in reporting on vaccines, and in the beginning, he was quite active in that as well. But we don't have, I think we have more females in the newsroom at ENCA. So I think that has a role to play in all of this. Masako also, who's a female, is quite big on health reporting. But I wouldn't say it's just a female thing. I mean, we have reporters out today at correctional services where that sector is going to start being vaccinated now. So I think it's more of an interest thing, and maybe reporters say, I'm not really keen on that. I wasn't really given a chance. My editor, Faith Daniels, was like, you will do it. You will stick to the story. So I guess females rule the world. So we got to report on health.
Thanks, Heidi. Ina, how do we get the men? Heidi has mentioned that they, in TV, maybe there's a few men in her newsroom reporting on it, but in the print world, it's very dominated by women. How do we get the men in?
I actually think, Mia, that, I just happen to be the head of the health section at the Conversation Africa, but most of my colleagues who are reporting on COVID-19 are men. And I do think that the men are there. They just are in different positions. So there's usually the higher ups. And as you mentioned about health journalists being a traditionally female role, but I do not think that there's like a concerted effort to exclude men. Men are reporting, we do hear their voices. If we talk about most of the experts that we quote, for example, they are men too. And I also just find it interesting that this question is asked. We see so many panels, panels that are just men. And it's a good thing, I guess. It shows that women are also starting to get recognized for our experience and expertise in the field.
Why do you think we need the men in the health field, in the health reporting field? So not necessarily the scientists. Why do we need men to report on health issues that, very often affect women more severely, as we've seen in the case of COVID as well?
I think we need diversity. Sorry. I think we need diversity of all kinds, because we are all human beings. And when we approach certain stories, we come we come at it from our own point of reference. So definitely having different voices in there would help us tell the stories in a different way. So as a Black woman in South Africa, I have a specific experience. And so my reporting, my coverage will come from that. So in that sense, we definitely do need that perspective from the men's point of view as well.
Thank you, Ina. And that brings us to the end of our discussion today, because we're going to go back to Reggie. But just before we do that, I'd like to read a comment of Nutandu, who is a field journalist for the Highveld Chronicle newspaper in Mpumalanga. And the comment is that they are happy to hear that Mbali mentioned that that COVID-19 needs to be talked about in many languages, not just English, but there's also a concern that PPE for journalists is not always provided regularly, and that it needs to be provided, and that we need to look after journalists when it comes to protection in the field. So thank you very much for our 4 panelists that made their time available. Thank you, Heidi, for talking about reporting in the field, Ina as a editor of op-eds and also as one of the writers of this manual, and Mbali and Portia, thank you very much for your contributions as well to point out what's needed as for community journalists, and also what this manual looks like. We're going to go back to Reggie from SANEF now, who's going to introduce Telda Mawariri from Internews.
Thanks a lot, Mia. Thanks a lot for that, guys. And thanks to all the panelists. That was awesome. That was fantastic. I'd like now to hand over to Telda Mawarire. She's the project director at Internews, and they commissioned the guide. And they were all the way behind this guide and all the way the work that's been done over the past few months. Over to you, Telda.
Great, thanks so much, Reggie, and thanks everyone. This is really wonderful. And a huge congratulations to SANEF and Frame Media, who partnered to make this guide a possibility. Just to remind you that those who are active on Twitter, I think we are tweeting under #COVIDGuide and tagging SA Editors Forum, ourselves, Internews, and Free College, as well as the wonderful individuals on the panel. So I'm not going to take up much time. When we commissioned this guide, we had also started experiencing COVID-19 in South Africa, which was about in 2020. We did a research at that time, focusing on about 8 SADC countries that was looking at the effects of COVID-19 in these SADC countries, of which South Africa was one. It was the findings of that research, that report that came out looking at the effects on freedom of expression and access to information, which of course included press freedom and journalism and so forth, showed us some things that we knew already, but some that were really amplified and made us see that there was need to have this local guide, not just one that is international. There was definitely a lot of issues coming out in a lot of countries around sourcing of information. Because everyone just became a health reporter overnight. Some newsrooms were also struggling with the issue of fake news, disinformation, misinformation, and so forth, with no clear guides for journalists on how to act around these issues. There was problems, of course, also of under-resourcing, which had been a problem before COVID anyway, and just became more pronounced after COVID. There was little or no training going on in the newsrooms, because the newsrooms themselves, as part of the media houses, were experiencing a lot of financial difficulties because a lot of advertising had been stopped, or the resources of advertising had stopped coming in as a result of COVID. Also on under-resourcing, a lot of journalists had been as well telling us that salaries had been cut, some their hours had been reduced. So this was also causing a lot of anxiety. There was also a lot of anxiety around reporting on COVID. I think, as Heidi mentioned, that a lot of journalists were having to go to isolation centers in Zimbabwe, in Malawi. We saw this a lot without any protective clothing being provided by the media houses, whom themselves also could not afford. Lastly, I think what also made us think about commissioning the guide is that in all these other countries that we looked at, the 8, a lot of minority groups, as in women, people living with disabilities, and other groups were complaining that the media was giving a lot of space to the government. So a lot of space was being given to health ministers, health departments, to just ramble on and on and on, sometimes even without interrogation about COVID-19. We, on our side, those who were reviewing the report, found this practice to be unethical, because space should be given to everybody. The space to freely express and be heard should be given to everybody. So we decided that it was a good idea to commission this report. Also, as it has been said, that there are very few, I think there's nobody who can say they've reported on a pandemic in the past. So we partnered with these 2 partners who have done this wonderful work to produce this resource, a resource that we also hope that SANEF, because of its standing, will be able to share the resource much more widely with the newsrooms, so that it just doesn't become something which sits, or something which just becomes the flavor of the day. There's obviously so much more, I think, work that needs to be done with guides like this, with things that have already been mentioned, such as the issue of languages and so forth, where resources would be possible. And also because the effects of COVID keep changing, we keep feeling them, in different ways. The pandemic rolls out in different stages in the different countries. So it's our hope also that this guide just doesn't also sit, but it evolves with time, and that others would be willing to take the work forward, including partners such as SANEF or FREY, where it would be possible to evolve it and to really focus on mental health, because that also was a big issue in our initial study, in our initial finding, that the mental health of journalists really was something that needed a lot of attention, with a lot of exhaustion and just feeling overwhelmed as well. So this is why we commissioned this manual, this resource, and I hope that it can be taken forward and that it will include other things. I see there's a lot of former colleagues in the attendees list who also work around data journalism. For example, I see Laura is there, and the issue of data journalism and how to include issues of data journalism in such manuals is also very, very crucial, because it's not only here in South Africa, but everywhere, I think, in our region in Africa, where journalists also are struggling with effective data journalism and unpacking data journalism for readers and viewers. So I think I'll stop there, and again, just congratulate our partners who have done a wonderful work, and just encourage now how to make sure that the guide goes as far as possible, and especially to community media, who sometimes are forgotten. I see that a lot of the people who are here are from the bigger mainstream, Joburg, Cape Town, Pretoria, mainstream media, but there's so much value in the community media, who are closer to the communities, and who are listened to, I think sometimes even much more than the bigger mainstream media. How do we make this resource also be available in print format for those who are not able to access it on the website, and who might not have as much data as a lot of those who are in the big metros are able to. So congratulations again, and I hope the manual takes a life of its own. Thank you, Reggie.
Thanks a lot, Tilda. That's much appreciated. Thanks for those kind of words. We are now going to call for a moment of silence. I think this moment of silence would be largely to, just pay tribute to colleagues that we have lost. I think we have lost quite a number of colleagues in the past few months. Those were colleagues all the way from our, regional to national media. So I think let's just observe just a moment of silence for them, please. Thank you. Thanks a lot for that. Colleagues, thanks for joining us. It's been quite an engaging past hour. I think just to answer Mia's question earlier, I think as SANEF, as an organization, we take pride in the guide itself, and we would like to really take the guide forward, and we are looking forward to having this guide live not only within our websites, but also within our various partners in broadcasting, online, and in print journalism. And it's a guide that also can guide us going forward when we are faced with such challenges. I think the pandemic has really presented a huge challenge for the fraternity as individuals, as human beings, but mostly also as businesses, and how so many jobs have been lost, so many lives have been lost. But the guide itself is also a great opportunity for us to continue using it as a guiding force as we search forward, as we look forward to the post-COVID-19 era. We don't know when is that, but I think this guide is quite key. And thanks to Internews, thanks to Frey for all the work. And as SANEF, we are appreciative. Thanks to all participants who joined us today. And thanks a lot also to our panelists. It was a great panel discussion, and we are quite thankful to that. Can I hand over to Sandra to now close and conclude? Thank you.
It seems like we have lost Dr. Sandra Roberts. She's having some network issues.
No, that's fine. That's fine. Do we still have Mia? Mia, you want to maybe conclude with closing remarks?
Sure. So as a journalist who've been around during 2 pandemics, I think it is so great that this manual includes a chapter on mental health specifically, as Heidi has also pointed out, because it's really a grueling thing to report on something that affects your own life so severely and give knowledge to other people, but still being scared about it being infected yourself, and also just the constant developments that you have to keep up with. And I think all our journalists in South Africa, also those who are not health specialists, have been doing on general a really, really great job about that. And people like Heidi is an example of general journalists who can be turned into journalists who report accurately on health during a pandemic. And I would like to thank all our panelists, also Ina, for editing op-eds that are so accessible when it comes to the conversation that spreads the message and accurate information about COVID, and also for Mbali and for Portia for contributing to this manual and also looking after journalists in a community field. And hopefully in a year or two's time, we can have more normal lives, but I think we need to continue to try and keep up with the science. And the most important thing, I think, in this pandemic is to break down science so that it's accessible and people can make sense of it. And that, I think, we are really starting to do in South Africa. And to end with, I'm so happy that our vaccination rollout is speeding up and is getting to a level where it's really starting to reach people. And our jobs on journalists is to keep track of that and to bring the information out there so that people know where to go for vaccinations. And congratulations again to SANEF and Internews and Frame Media for this manual. Back to you, Reggie.
Thanks a lot for those kind words, Mia. Thanks a lot to Internews and Frey, and thanks to Heidi, to Ina, to Mbali, and to Tella. And yeah, I think we have come to the end of this wonderful discussion. Stay safe, stay warm, everyone. And yeah, stay safe, get vaccinated when the time is there, when the opportunity is there, and keep well. Thanks for joining us. Thank you.
Thank you, everyone.
Thank you.
Thank you.
Thank you.
Bye, everyone.
Bye.
Bye.